In the United States, Black women are more than 3 times as likely to die from pregnancy-related complications than white women. Even with all the advancements in medicine, this disparity hasn't gone away. Today, we're diving into the systematic racism and structural inequalities behind this crisis and the community-driven solutions that are working to make a difference. This issue has deep roots in America's history of systematic racism. Policies like redlining didn't just segregate neighborhoods, they also blocked access to quality healthcare for Black communities. A 2021 study led by Dr. Crear-Perry, founder and president of the National Birth Equality Collaborative, explains how these historical injustices created structural barriers that still decide who gets life-saving care and who doesn't. And it's not just history. Implicit bias and discrimination in healthcare are still big problems. Providers are less likely to take Black women's pain and concerns seriously, which leads to delays and inadequate care. Joku and colleagues, 2023, described this as a lasting impact of institutionalized racism combined with a lack of cultural understanding and medical training. The statistics are shocking. Black women face a maternal mortality rate of 55.3 per 100,000 live births, more than triple that of white women. And these numbers don't change even when you account for income, education, and pre-existing health conditions. This isn't about individual choices, it's a systematic failure. One way to understand this issue is through the weathering hypothesis. Developed by Dr. Arline Germosis, it suggests that chronic stress from systematic racism leads to premature aging and health vulnerabilities in Black women. This stress affects their bodies biologically, making pregnancy and childbirth even riskier, as Joku and colleagues explain. And let's not forget how environmental factors contribute to this stress. Studies show that Black communities are often located in areas with higher levels of pollution, fewer green spaces, and limited access to nutritious foods. These environmental stressors compound the health risk for pregnant Black women.
I felt like I was pushed aside. I felt like my feelings weren't taken for granted. I felt like a real disconnect from the physician's office that made me not want to advocate or speak on how I was actually feeling because they were not concerned with how I really felt.
Mistreatment during childbirth is another piece of the puzzle. Vidam and colleagues, 2019, found that Black women are more likely to experience verbal abuse, being ignored, and even neglect during labor and delivery. This isn't just a violation of basic human rights, it directly harms both mothers and babies. Imagine being in labor and feeling dismissed or unheard by your healthcare provider. That kind of mistreatment doesn't just affect the physical health of the mother, it also leaves emotional scars that can last a lifetime. But there is hope. Community-driven programs are making a difference. For example, patient navigation programs, highlighted by Alhalel and colleagues 2022, help connect Black women with culturally competent providers who truly listen and address their needs. Organizations like Black Mamas Matter Alliance are also leading the way, advocating for policy changes and providing resources to empower Black women to take control of their reproductive health. The reproductive justice framework, emphasized by Crear-Perry, also offers a powerful lens. It's about more than healthcare. It's about the right to have a child, not have a child, and raise children in safe, supportive environments. This shifts accountability from individuals to systems and highlights the need for structural change. Policy changes are a must. The American College of Obstetricians and Gynecologists, ACOG, recommends redesigning postpartum care to fit each person's unique needs, like longer follow-ups and mental health support. We also need to increase funding for maternal health programs and hold healthcare systems accountable for addressing bias. And we can't stop there. Policymakers need to listen to the communities most affected by these issues. Solutions that work in one area may not work in another, so tailoring policies to meet local needs is critical. The fight for equitable maternal health is far from over, but we've seen that progress is possible when we tackle the root causes and amplify the voices of those most affected. Whether you're a healthcare provider, a policymaker, or a community member, We all have a role in making sure Black women get the care they deserve. Let's work towards a future where every mother, no matter her race, has the chance to thrive.